right now. Good afternoon. I hope you're all well and staying safe. My name is Ralph Biederman, and I'm the Executive Director of the Mid-America chapter of the U.S.-Mexico Chamber of Commerce. We'd like to welcome you today to our sixth webinar in our series. The third one hosted with the Consulate General of Mexico here in Chicago. And all of the webinars have been sponsored by the law firm of Baker McKenzie. Today we have an excellent group of speakers from a very broad and diverse industry in Mexico, and that is medical devices. The companies represented by the speakers, Medtronic, Medline, and Hillrom, are all headquartered within our Midwest geography, which is very nice. If any of you have any questions as we go along, please use the chat button. I will have some questions at the end, and I think we'll have enough time to have a very good panel. So talking a little bit about our chapter, we're a binational chamber with headquarters in both Washington and Mexico City. We are a 501c6 nonprofit corporation. We started in 1973. And the purpose of our chamber is to build mutually beneficial trade and investment relationships between Mexico and the United States. Today we have 18 chapters. We have 10 in the United States and 8 in Mexico, with a membership of over 550 companies and organizations. We have numerous groups and task forces, such as the North American Working Group, which is comprised of members that review and analyze trade issues between the two countries, and then provide recommendations to appropriate agencies of governments in both countries. Since May of 2017, we've held 13 live breakfast series sessions with members and friends here in Chicago. Anybody who wants to participate to openly discuss trade issues and their impact on their organizations. Of course, since COVID-19, we can't do that any longer, or at least not, haven't gotten back to it yet. But we do provide many updates on issues probably every 3 or 4 weeks to our growing group of concerned individuals in the Chicagoland area. This video is being recorded, and the video and all the PowerPoint presentations will be available at our website. Especially look at our resources page, where we have basically reports and analyses of trade issues, not only with Mexico, but Canada, the UK, the EU, China, and so forth. You'll find it as a very great resource. Our lineup today, we have Ambassador Reina Torres, the Consul General of Mexico here in Chicago, Gerardo Guerrero, the Consul of Mexico in St. Paul, Angel de la Campa, who's the President of the Baja California Medical Devices Cluster, Javier Gonzalez, General Manager of Hillrom de Mexico, Miguel Rochin, Vice President of Operations of Medtronic Mexico, and Cynthia Eustares, Director of Textile Operations for Medline Industries. All of their bios were with the registration materials, so you can see more about the individuals. So with that, I'm going to stop the sharing, and I'm going to turn it over to the Ambassador. Welcome, Ambassador. Thanks again for joining with us today.
Thank you so much, Ralph. And once again, thank you for the opportunity to collaborating and partnering with the U.S.-Mexico Chamber of Commerce Mid-America chapter in these webinars. As you mentioned, this is the third one. We have done 2 other very successful webinars, one on automotive industry in December last year, and one earlier this year on technology. And we're planning to do more, so stay tuned, because we're going to keep talking, keep the conversation open on aerospace industry, supply chains, and other issues that are relevant for the stakeholders in the trade between Mexico and the U.S. In this webinar, what we are trying to do is to continue the conversation on USMCA and all the opportunities that this updated treaty between the 3 countries are bringing to the North American region. We think that the more we learn about these new developments, what the USMCA brings to the table, I think we are better able to take advantage of the opportunities of integration, and we can really construct the most competitive region in the world. I think we're destined to be partners, and I think that it's only appropriate for us to look for all the advantages that this partnership brings to the three countries. And it was a no-brainer to choose the topic for this seminar. You know how it has become a center issue in the last year and a half because of COVID-19. The use of medical devices is very important. It was very important for COVID-19, but now it's much more visible, let's say, how this sector of the industry is important for trade, but also for the states at the local and federal level, and also for universities and many other stakeholders that participate, making this industry really at the center of the economic exchanges that we have between the two countries. You know that this USMCA brings new standards, new regulatory standards to this industry, and that now the medical devices industry has become one of the examples of how important is to have reliable supply chains. This is a perfect example, and we will see this with our panelists, how it plays a role, and it demonstrates how supply chains are constructed in critical components that make successful this industry. Just to give you, some figures, I know that our panelists are going to further talk about this. Mexico is the largest exporter of medical devices to the United States and the leading exporter in Latin America. Mexico exports around $7 billion only last year. And the Mexican medical devices sector also represents an important market to the US exporters. Last year, the US exported almost $3 billion to Mexico. And Illinois, same year, last year, exported around, of all its exports, around 20% there was an increase of 20% compared to 2019. So you can see how the pandemic had been an element in all this. The products that Illinois exports to Mexico rank in number 3 just after corn and motor vehicles. So you see how strong are the exchanges between Illinois and Mexico. And now, it's only natural that we chose Baja California, and many industries settle in Baja California because it turns out that Baja California has grown its production in 50%, and they represent a large amount of the market in Mexico, and they are very successful exporters. They have settled an example in how a cluster can be constructed, in which public and private stakeholders participate, but also universities and technology. So this industry, you of course know that congregates different elements that make regions and that can make an impact in the development of the regions. And that's exactly what's happening in Baja California. So without giving away anything else, because we're going to have the experts in a few minutes, I'm going to introduce my dear colleague, Gerardo Guerrero. He's the consul in St. Paul, Minnesota, and he is here because precisely in Minnesota, there are settled many industries that exchange with Mexico and are part of the supply chains that we have constructed in the previous years. So Gerardo Guerrero has been the 4th consul in St. Paul. He's been working in the Ministry of Foreign Affairs since 1987, and I'm not going to say anything else, just that he's an expert in legal affairs, and we are delighted to have him here. So go ahead, the microphone is yours, Gerardo. Thank you.
Thank you, Ambassador. You have your mute on. We always forget that one.
Sorry. Thank you very much, Ambassador. Good afternoon. I want to thank the United States-Mexico Chamber of Commerce, Mid-America Chapter, and Ambassador Torres for the invitation to participate in this event. And also, it's an honor for me to share this remote session with the rest of participants in this webinar. As already was mentioned by Ambassador Torres, medical device manufacturing has become one of Mexico's fastest growing manufacturing industries, and due to the circumstances created by the COVID-19 pandemic, can further strengthen its position in the region and in the world. There are several reasons for Mexico's importance for the medical device market. Mexico has already built a robust chain of manufacturing training, industrial communities, and workforce skilled in undertaking highly complex manufacturing activities at rates significantly more competitive than possible in the United States, among other countries. The Mexican medical device market is sophisticated and values innovative, high-quality medical technologies, advanced yet cost-effective products that deliver strong healthcare outcomes will perform best. Medical devices in the areas of preventive care, diagnostic imaging, dental products, patient aids, orthopedics, and prosthetics are in greatest demand. Many of those devices are small and must be manufactured by hand, which requires various stages of construction. The multiple part assembly process requires highly skilled labor abilities easily found in Mexico's workforce. In addition, this market was close proximity to some of the largest medical markets in the US. San Diego, California ranks third in the life sciences in the US, with more than 600 companies based in that city, and continues to attract groundbreaking medical research companies. This booming market is just half-hour drive to Tijuana in the state of Baja California, where the medical device manufacturing industry is one of the leading local employees. Over the years, Baja California has become a world leader in medical device manufacturing with facilities that are FDA and ISO certified. I am sure Miguel Rochin will talk about this, but as Consul of Mexico in São Paulo, I have to mention the importance of a Minnesotan company in Mexico, which is Medtronic. Medtronic, which supplies an incredible wide breadth of medical products, has been operating in Mexico since the 1970s. Medtronic has more than 13,000 employees, 5 manufacturing plants, and a network of distributors in Mexico. Tijuana is home to the company's second largest assembly plant in the world, where approximately 4,000 workers assemble catheters and human hair valve replacements. And also, I have to mention this, that, for example, here in Minnesota, we also have in Rochester, one of the most important hospitals in the world, which is Clínica Mayo. And when I was posted as Consul of Mexico in São Paulo, I met with people of Clínica Mayo. And I'm sure that you have had the opportunity to visit Clínica Mayo. It's just amazing. And for example, they were very interested to have Mexico producers to have Mexican companies to provide medical supplies. So I think that we have a great potential, a great commercial potential between the two countries. As we're going to hear from today's experts, and as already Ambassador Torres mentioned, that Mexico will keep its important position as one of the main producers of medical devices due to the increasing demand from the U.S. medical sector, and the new U.S. and Mexico-Canada Trade Agreement, USMCA, will help to that. With the entry into force of the USMCA, the medical device industry has secured the recognition of international standards, elimination of the duplicative regulatory requirements, and expansion of intellectual property protections. USMCA, unlike NAFTA, allots medical devices its own annex. This annex expedites the commercialization of devices by avoiding duplicative regulatory requirements and coordinate efforts to harmonize regulations with international fora, reducing with any administrative burden. Additionally, with this annex, the medical device industry can seek out increased protections for patents as intellectual property standards harmonize, benefiting patients by being provided greater access to the latest medical technology. So thank you very much again for the invitation, and I wish you all a very successful webinar. Thank you.
Consul and Ambassador, thank you very much for your opening remarks. Angel, you're the next speaker, but boy, they gave you a good lead in here. Why don't you take it from here and tell us a little bit more about the association and the cluster?
Sure. Good afternoon, good morning, everybody. I'm Angel de la Campa. I'm the president of the Medical Device Cluster in Baja California. I will share with you some information regarding the medical device companies. So first of all, we have board of directors that I'm honored to be the president, and we have other 3 members that they help me to coordinate with the rest of the industry. Going a little bit from high numbers, going down, drilling down to Tijuana, as the ambassador mentioned, the global production on medical device dollars, we're talking about more than $600 billion, and Mexico produced around $70 billion of those. Mexico is the 14th global importer and the 8th global exporter. We import around $5.5 billion and export around 11.5 or 12 billion dollars every year. As it was mentioned, we have a very spread brand of product that we produce that go from syringes, catheters, needles, surgery fortitudes, catheters, heart valves, and so basically we touch all the body, and not only the body, but as well we supply a lot of medical devices to support the procedures. Out of those exports that Mexico has, Baja California represents 50% of those exports that Mexico do to the world. Baja Medical Device Cluster is the largest one in America, Latin America. Who are we, or what we are looking for? We are a group of companies that we work in a sector of medical devices, and we collaborate strategically to obtain common benefit for all the industry, medical device industry, and as well for the community. So based on that, our purpose is to improve the performance of medical device industry in Baja California through the consortium and create the synergy of all the manufacturing companies to be working together with public and private companies, supporting their growth, competitiveness, and training. We have a lot of relationship with universities, with other organisms to support our growth. We have a strategic plan that basically we are talking about 6 main activities. First of all, we try to work out with, have our stockholders working together with them and fulfill their requirements and needs. We support suppliers and try to integrate them in our supply chain models and try to develop local supply in Mexico, in Tijuana. We increase innovation and we have a lot of research and development practices in the industry, not only on the manufacturing processes, but as well we already start working with R&D processes. We try to not only be leading the manufacturing as well, but we try as well to as we are very our companies are very regulated, and we have a lot of regulatory bodies coming down here. We work together to improve our capabilities and our qualities in order to be ready for any regulatory inspection that we may have. Could be FDA, could be COFEPRIS in Mexico, could be the TUV, wherever a regulatory body is in the world, we are ready to receive them. As well, we follow all the regulations and of course national regulations, and we are on the top of them just to be competitive and develop the human talent is the most important thing. As you may see in the following slides, we have a lot of employees that we need to be developing and having competitive not only for Mexico but as well worldwide. As you can see here, Tijuana, we are in the northwest of the country in Mexico, and we have five locations where you can see that overall Baja California, we have 78 manufacturing plants and more than 76,000 direct employees. And we're talking only direct medical devices companies. We're not talking about here, including the suppliers. It's only direct employees that they work for medical devices. Tijuana is leading the numbers here with 50 companies and 53,000 employees, followed by Mexicali, that they have 18 companies and 15,000 employees. The rest of the cities are very close to us. As I mentioned to you, we have a very spread branch of products that we go from everybody, all the places from the body, but as well to support all the medical activities related to keep the welfare of the health of the human beings. Here in Tijuana or Baja California, we have the presence of well-known corporations, as it was mentioned at the beginning. We have Medtronic, we have Hillrom, we have SAES, Fisher & Paykel. So as you can see, we have a very, very huge and well-known corporation over the area. This is just to give you an example of how close we are from the border to the U.S. You will see over here, we have the border. This is Mexico, this is Tijuana, and then we have San Diego and San Isidro are Mesotai. So as you can see, all the companies, we are very close to the border. By the way, Tijuana border has been defined as the border with the highest number of border crossing, not only from people, but as well for product or product branch to go to the U.S. So basically, this is the overall of the industry, medical device industry here in Tijuana. And just if somebody wants to have more information, here are some links that you may look for, and we are ready to attend any question that you may have now or in the future.
Javier, thank you very much for an excellent presentation. I'm sure we're going to have some questions afterwards. We'd like to turn it over now to Javier Gonzalez with Hillrom in Monterrey. Javier, the floor is yours.
Thank you. First of all, thanks for inviting us, myself and Hillrom, to this important panel and this important event. So I will start to share my presentation. So I will speak about Hillrom, and basically it is the who we are, and some of you are familiar with this concept as Angel just mentioned. A commitment to innovation and leadership. For over 100 years, we provided care teams an increasingly intelligent, connected solution across all care settings. As you can see here, from optimizing surgical capabilities efficiently and safe with our sophisticated operating room. The following is to accelerate recovery with our innovative products, therapies, devices, and mobility programs. Third, the driving patient safety and satisfaction by enhancing clinical workflows and communications. And now with the one of our key strategies is all the time to be connected. Hillrom leads the way in enhancing outcomes for patients and caregivers. So 100% connectivity, it is one of our strategies as well. Our mission, or why we exist, every day around the world, we enhance outcomes for patients and their caregivers. Our values, or also what I call it is the rules of the game, definitely start with respect, accountability, results, integrity, teamwork, and fun. United our brands into a clear vision. If you know these brands, then you know Hillrom, Allen, Volti, Trump, Lico, Welch Allen, and Mortara. So now it is under one brand or one concept, which is the Hillrom. As unified team with a singular purpose, we can have the three focus: better help customers achieve their clinical objectives with products they already know and trust, create a platform for connected innovations and technologies across our portfolio, and enabling accurate diagnosis, earlier innovation, and faster recovery times. Hillrom's global businesses, patient support systems, the Smart Bed act as the hub of clinical data and patient safety application enabling by a robust care communications platform. Second one, it is the frontline care, advancing connected care platforms that empower clinicians to proactively care for patients anywhere. And surgical solutions, enhancing the surgical environment of care with integrated solutions that improve efficiencies and outcomes. This is the way we are living our commitment wheel every day, every time. So as I already mentioned, our values, which are respect, responsiveness, integrity, results, and fun. But in the middle of this, it is our commitment. Patients and caregivers is our passion, our passion, sorry. Quality matters in all we do. As a medical device industry, all of us know that what is the number one or one of our key focus, it is the quality in order to do it right the first time. Financial discipline, driving the values. Here, as you mentioned in several times, COVID situation, we are facing some challenges, specifically with the supply chain, and we are facing this situation or adapting that situation in order to move forward and do not interrupt the supply chain products of our, the supply chain of our products, sorry. Innovations, it is our fuel for our growth. Continuous improvement creates simplicity and people inspired. It is to win together. This is all our plans or sites around the world are focusing in our true north. This is the example for the fiscal year 21 Monterrey. And it is basically on three aspects: who we are, as I mentioned previously, what we must deliver, that is our commitment, and how we measure our success. So the who we are, it is all the time play to win, be great team players, do the work and improve the work, know your customers and meet expectations. What we must deliver, we are focusing in 4 dimensions: people, quality, delivery, and cost. On people, take actions to ensure a zero harm workplace. This is one of our key let's say priorities, and more important today with the facing the COVID third wave, if I may say that, but we are focusing on that. Ensure a high degree of employees engagement and take actions that advance diversity, inclusion, and belonging. How we measure those or what is the focus or delivers how we engage our people in those in the people aspect. We recordable incident rates 0.26, energy use versus VOP 3%, and engagement 90%. The second one, it is quality, constant audit readiness, relentless focus on zero defects, improve our quality subsystems, how we measure those focus in quality complaints, 10% reduction year after year. CAPA, timeliness and effectiveness, 95%. Most of you are familiar with this concept. And definitely audit readiness. We have to be ready all the time in order to receive any kind of audit. Will be regulatory, will be legal, any kind of audit, we have to be ready every day. Delivery, create a robust planning system, optimize the end-to-end network, and achieve inventory and services level targets. How we measure it: service level 98%, days on hand, this is a monthly target, and back orders no more than 94,000 per month. And cost, it is to achieve the total cost targets and achieve year-over-year cost improvement. How we measure it: total cost monthly target. So every, let's say the end of the month, we review our P&L and where we are, not only for the month, but also for the quarter and projection for the year. BIP, this is our year-over-year, program that we have to reduce, or our focus is to reduce 6% every year, not only in direct material, but also in indirect, which is the 4%. Now we are going to the details of the Tijuana site, who we are. This site started operations in 2006. Our business is manufacturing medical diagnostic devices, digital thermometers, blood pressure cuff, and lamp distribution, Our distribution of the OEM products, respiratory disposable circuits. We have 665 employees. Our site director, it is Gabriel Sanchez, and other functions are financial services for FLC and post-market surveillance for Hillrom Hillrom products. This is where it's located. Most of you are familiar with this geographical situation. And this is the slogan for Tijuana, as we all know. Here begins the homeland, or aquí empieza la patria. 3.7 million population. And more details about the Hillrom site in Tijuana. The manufacturing area is divided in 2 buildings. Building number 1, 130,000 square feet. This is where we have the value-added manufacturing areas, main offices, and shared services. And the second building, it is 75,000 square feet, mainly driven or focusing on warehouse, final point configuration, and shipping. Definitely, here it is the Tijuana management team. And here to mention, it is very important that all of our sites have organizational metrics structure, means that we as a directors of the sites, we have solid line reports, as you can see here, with manufacturing, managers and logistics, senior manager, just to mention somebody. On the other end, we do have a dotted line, which are basically the support, starting with HR, director of QARA, manager it is an open for costing or accounting, and manager for commodities. So in some instances, we also share those services between the Monterrey side and the Tijuana side. Our geographical or demographic, is direct labor 578, factory indirect 84, technicians 42, professional services 61, and gender female 65% and male 35. This is our Tijuana operations, and as some of you mentioned previously, we have to be registered by FDA, certified with ISO 13485. In this side, we have the pleasure to mention that we have a great place to work, and some important entities or legal entities certifications as Profepa, and the recognition from the government of Baja California. Our products are thermometry. As I mentioned, we have here some pictures about those products, blood pressures, and exam lights and bulbs. Now we are moving to the Monterrey side. Here, Monterrey location, as you can see, it is, we also consider part of the north, but not as north as Tijuana, as you can see here. This is another representing the Monterrey area, which is El Cerro de la Silla, and also is recognized as the industrial capital of Mexico with 5.6 million population. This is the Monterrey management team, myself as executive director, and again, same organizational structure that I mentioned, direct reports, the operations, and dotted lines with the support functions. As you can see, QIRA directors, finance, sustaining engineering, sourcing, IT, indirect sourcing, and HR. More information related to our campus. Here we have 2 million square feet as a campus. As you can see, basically half it is the building and half it is for open space for future growth. And this is more general information. As I mentioned, we have 2 product families, frames. We did start the operation with the first family product in 2007. And we start to move a product or develop products into 2008, another product in 2010, and the last it is Centuries or LPC in 2015. Good to mention that we also added the medical surfaces starting on 2016. Our manufacturing area, it is 238,000 square feet. Demographics, organization and demographics, headcount 315, male 51%, female 49. Average age, it is 35. Average seniority, it is 4.5 years. And more specifics or information related to our products. On frames, we build close to 11,000 now based on this increasing demand, but the when I prepared this information, it is 10,500 for this year. And those two are the families that we are producing right now, stretchers and care assist, and not only finished good, but also service. Related to surfaces, it is 76,500 units per year. And those are the products family that we have built here in Monterrey: Pro Plus, stretchers, Affinity, NP100 and NP50, Acumax, Compella. And next year, we will introduce another product line, which is the Helios. Regulatory and legal, UL certification. This is because of the all the electronics and electric devices or attributes that our products have. CE mark, FDA certification, ISO 13485, Korean FDA, Anvisa for Brazil, IMEX. Here in Monterrey, we are participate through the Maquiladora industry program. The Secretary of Mexico Labor Law, Semarnat, and OMS, which is our operational management system. This is some pictures about our products. In our left side, it is our what we call surfaces. And as you can see, it's not only the foam of the comfort, but also the fabric or the material we use. It is to maintain a very low level of humidity between the body and the surface and improve the recovery of our patient. And also, you can see there are some what we call bladders or air systems that maintains the pressure of the and improve the comfort of the patient. On the other hand, it is the stretchers on which we build those 10,000 plus per year, divided by surgical, transport, trauma, procedural, and OB generation. So probably you are familiar with these products at the moment that you visit the hospitals. Our processes, it is very broad concept or explanation. We receive suppliers all over the world, and now it is quite of a challenge because of the all the COVID and restrictions and some limited or increasing time for those basically for Europe, Asia, and some USA as well. We do have the common inspection in the majority of our products, warehousing, manufacturing process, and divided by two focus frame that we call it here. One, it is the frames focus factory, and the second one, it is the surface focus factory. Within the frames, we do have vertical integration starting from raw materials, I mean, welding, steel bars, welding, painting, and assembly. And as you saw the product, and on the surfaces area, it is the cutting, sewing, and RF welding or radio frequency welding process. After that, it is shipping, and we are delivering the majority or most of our products to our Batesville distribution center. A very brief explanation of what is the operational management system. This is basically in order to maintain all of our focus in, as I mentioned previously, to the true north with those 4 dimensions: people, quality, delivery, and cost, and those 6 pillars that we are focusing every day, every time here. Strategy deployment, performance culture, daily management system. That means that we do have tier 1, tier 2, and tier 3 meetings. 5 S's, definitely. The VIP, as I mentioned, it is 5% commitment, cost reduction year after year, and problem solving. Good to mention here, it is our, we received recognition or award in 2019, and also the VIP award in 2019. Definitely, we don't do this alone. So this is our key competitive advantage, our people. We do have great people, great results. We do have social responsibility, also recognition of work, and more important, it is benchmarking as well. So within the plants, and with not only internal but external, we do and we have a benchmark in order to continue learning from each other or from other outside Hillrom. Definitely, and here in Quality Matters, we developed this Luchando la Calidad. This is one of the key topics, and this is the way we are engaging our people in order to participate in the zero defects and also creating that synergy among the quality. And as you can see here, is not a coincidence. We have a Medtronic picture here on which we did a benchmark last year. continuous improvement programs. This is basically everybody's responsibility. As you can see, there are groups of admin, there are groups from production, and those boards that you can see here, it is our daily management system on which we have tier 1, tier 2, and tier 3 meetings in order to ensure that we are focusing in those 4 dimensions: people, quality, delivery, and cost. And more important, how are we measuring and how we are assuring that we will improve and meet our expectations as a site, and definitely with our customers and quality. Definitely here is one of my interesting values, as I mentioned previously: having fun, Halloween parties, Christmas parties, engagement also with our, not only internal, but external with our community. And here in Monterrey, we do have every day, or every year, sorry, the welcome or home welcome and the site. Unfortunately, here with the COVID, there are some restrictions, but as soon as we have more open position or open situation, we will reactivate that. And we will bring our families in order to understand where we work on or spend 12 hours every day, sorry. And also to allow our sons and daughters to participate with us. And basically, this is what I have to share with you. Again, thank you very much. And I will stop sharing in order to move to the next presenter.
Thank you very much for an excellent presentation. Miguel, tell us a little bit more about what Medtronics is doing in Mexico.
Sure. Thanks, Ralph. Let me share my screen.
Good. Got it.
Okay. Can you see it right?
We can see it.
Okay. Thanks again, Ralph, for the invitation. Good morning, good evening to everybody. My name is Miguel Rochin, and I'm operation responsible for the Medtronic El Lago site and also for our plant in Empalme, Sonora. So I'll be presenting a brief overview of what Medtronic does here in Tijuana. So first of all, the strategy has been for the region to attract high-tech manufacturing, specifically into the aerospace, medical device, biotechnology, and logistics areas. Obviously, we, as part of the United States-Mexico-Canada Agreement, previously, or TEMEC as we know it in Mexico, we are in a privileged position, not only for the trade agreement, but also particularly for Mexico, we have a close access to the United States, where most of their products are destined from there, shipped to every part in the world. What do we have to offer for the international companies? First of all, we have access to educated workforce. All of the professionals are bicultural and bilingual. You know, I'm original here from Tijuana, born and raised in Tijuana, and it is very common that kids and young students do the grammar or high schools at the United States. So we have that interrelation with the American cultures in early stages. So that's very helpful to understand how business are conducted. Obviously, Mexico is a cost-efficient country. We have a stable inflation and a pretty stable economy on on the country. And the medical device industry has been established for many years now here in the Baja and also in Tijuana. So Angel already shared that part. That obviously it's a good note and you know, testament for trust that Mexico can produce high quality products all the time, deliver on time, and also being cost efficient. So it's not only cost what drives companies to be in Mexico, but mainly, and as Javier mentioned, the top priority for medical devices is high quality. Ensure that the products that we make will help people's life to enhance people's life. So Medtronic has been established in Mexico since 1978. We have 4 manufacturing locations, 2 here in Tijuana, 1 in Empalme, Sonora, and another one in Ciudad Juarez. Also, we have a sales office in Mexico City. So Medtronic provides direct employment to close to 14,000 people in the country. Also, Mexico is an emerging market for medical devices, so could represent a good business opportunity if we can produce the products and bringing into Mexico as the population and the health system requires. Now, what we do in this facility? Basically, this facility was established in 1998 as an extension of Medtronic International Vascular, and then it grew through the years. Nowadays, we have more than 6,300 employees in this particular facility, which is comprised of three buildings where we perform manufacturing, plus our third P&L supplier, which is close by to the location. There are a number of technologies established on the site, as chemical and steam sterilization, injection molding, bioactive coatings, laser welding and laser cutting, and a myriad of different technologies that are required to properly support operation. We have here around 165,000 square feet of state-of-the-art clean room that are designed to the highest standards in order to comply with the manufacturing requirements. And also we have relationships, a business relationship with most of the main players for sterilization services. As you might know, medical devices are most of the medical devices are subjected to a terminal sterilization process to ensure that those are microbiological safe. So is one of the by the way, is one of the capacities that we are working to develop with local suppliers. We now have the ability to do local sterilization with eBeam, with a supplier that's established in Tijuana, and currently working in a project to qualify ethylene oxide facility to provide those services as well. So just so you know, Medtronic is the largest medical device firm in the world. In terms of operation, is comprised of 4 operating networks, is how it's structured. And this particular facility supports one way or the other to all of those networks. Or main part of the the businesses with interventional vascular and structural heart, but also with cardiac surgery and active implantables and machine implantables. So we have a good representation of all the networks within Medtronic, which again provides a testament of the trust that the Mexico operation has built with the corporation to bring more and more products into the site. These are the products, main products that we make here. As you can see, we have products that are used in coronary bypass heart surgery. So these are blood management products that are used for blood extracorporeal circulation while an open heart surgery is being performed. We also have intracranial coils that are used for cerebral vascular aneurysm. We have a huge amount of catheters that are built here, both coronary catheters for balloon angioplasty, as well as catheters for stent application. Both could be both bare stents or drug-eluting stents. We also manufacturing peripheral catheters that are used on limbs, and also for the to treat to deliver the drug-coated balloons therapies. We also make products to treat the aortic abdominal aneurysm, and I want to make a special mention for this aortic valve replacement, which is a valve, a cardiac valve that is produced manually instead of using the native valve of directly into the patients. What we do here is take the porcine pericardium and cut laser, treat it to inactivate metabolism, then cut it by laser technology and hands-on into a nitinol frame. One single valve can take up to 14 hours to be made, and it has around 1,000 different stitches that are manually applied. The beauty of this technology is that the valve is applied using a catheter, so patient can recover within a couple of days, as opposed to open heart surgery that can take months. So it's not only helping the patient with the disease, but also reduce risk during recuperation. So all the aortic valves that Medtronic produce are built in this facility in Tijuana by Mexican people. So we are very proud of that. So we have you know, more than we have products to treat different conditions with more than 52 therapies. We harness the power of technology to offer solutions for patients. So again, there are some very complex and technical related processes that Medtronic Mexico has demonstrated having the capabilities to handle those challenges with and produce the highest quality products. You can be sure that in Mexico we can produce products equal or better than any other part in the world. So since 1988, when we were founded here in Tijuana, it has been a long journey of growth. Besides of the organic growth, we also have grown through technology transfers. At the beginning, we used to bring into the site product lines that were already mature at the offload site, and we continue to build products to supply the market. With time, and again, based on the results, we have been able to start also manufacturing lines directly when a product is released from the product development process. So working together with the R&D groups to implement the manufacturing lines here in Mexico, as opposed as to have to wait that the line matures somewhere else before bringing it into the site. So this is just a quick representation of how we have grown over the years. As you can see, this facility was basically built from scratch, and also our growth was. I started here in 1999, and we were around 100 employees. Right now, we are in the, as I mentioned before, in the 6,300 mark, and you know, continue to see the growth in terms of space as well. It has been a continued growth over the years. And you know, talent development is key for success of our operations. So we have established a partnership with the different colleges and universities to ensure that we have not only that we have access to the best talent, but also that we develop and establish the programs that are required to support the ever-changing needs from the industry. So that's key. That's key for the success of any operation. You know, having the best people and the best people available, and also continue to develop at the rate that the industry also develops. We cannot fall behind, because we will lose competitiveness, and also we will not be able to stay on top of the game. And then, as an example, here we had a collaboration with a local university, Medtronic, and the St. Claude State University, in which we developed a master degree program fully focused on the curricula required to support the medical device manufacturing. So we are very proud of that, because you know, it was a paramount effort to get together three organizations, two of them in the academy, and develop this program, put it together, attract the people, and I'm proud to report that we already have our first cohort of graduates, and the second one is in process. And the next one, this is our vision of us as a site. You know, we want to become the best manufacturing innovation center, expanding maternity capability to save lives. So, myself and my team, we are sure that we can become the best. We have through the years faced many challenges being able to overcome. But it is not only an aspiration. We have put a plan behind that to make it a reality. Again, Mexico has a lot of talent, a lot of capabilities, creativity, and innovation that will allow us to be the best. It is what we should aspire, and we shouldn't settle for less. So finally, just a few key messages. Consul Guerrero mentioned that we were the second largest site. Actually, nowadays, we are the first largest site for Medtronic in terms of headcount. We are able to provide high value in our manufacturing processes at a low cost. Year over year, executing on growth initiatives that pose complex technical challenges and leverage or structure to be most cost efficient. But first of all, as a main is the commitment that we have to the Medtronic mission. We have the fortune in the medical device industry to not only produce a product, but as I tell my team every time, we produce life, because with the products that we make, we help many people around the globe to have access to a better, healthier, longer life. So that's key for the success of any company within Mexico, especially for us in the medical device area. Thank you.
Miguel, thank you very much. That's a great way to end your story with that the last message. Thank you very much.
Thank you.
Cynthia, tell us a little bit about Medline and Medline's history in Mexico. Cynthia,
Hello,
it's all yours.
can you hear me? Okay, good. So I'm going to start by telling a little bit about me. I'm Cintia Ustariz, Medline Industries Director of Manufacturing for the textiles operation. I've been with Medline for a bit more than 5 years, supporting their Western Hemisphere operation. I want to thank the United States-Mexico Chamber of Commerce for inviting Medline to share with you all who Medline is, and also to be able to highlight the great partnership that we have been able to develop in Mexico. Thanks to Ambassador Reina Torres and Consul Gerardo Guerrero, panelists and participants for your time as well. So our history with Mexico started more than 30 years ago. We are proud of the partnerships that we have developed in many states and cities of the country. Yucatan, Campeche, Nuevo Laredo, Mexicali, and Coahuila are some of those states and cities. This partnership definitely has supported Medline customers all over the world, and we are proud of that relationship. So who is Medline? Medline was founded in 1910 by the Mills family. We are the largest privately led manufacturer and distributor of medical supplies today. The company is on its 4th generation family leadership, with their headquarters located in Northfield, Chicago. We are always committed to our customers, colleagues, communities, always open to new ideas, two-way communication, and challenge the status quo so we can make healthcare run better. This is some of the challenges that we face every day, and we want to make sure that we make healthcare better every day. Can you see my full screen, Rolf?
Not yet.
Okay.
There you go. Got it.
Got it? Okay. So Medline has had a story of strong performance. Throughout the years, we have been positioned to provide products, education, and support across the continuum of care. We have been for more than 50 years on consecutive growth in revenue, but supported by a team made of more than 1,700 direct sales reps that have an outstanding expertise. They know the healthcare business from the bottom up and the top down. We have more than 2,700 employees worldwide, clinicians, researchers, engineers, financial experts in more than 125 countries, with the ability to bring the best practices from one care setting to another, from large healthcare systems to home health patients and their families. We are everywhere our customers are, 19 million square feet of warehousing with more than 50 distribution centers, all strategically located to provide consistent delivery, product offering, and service to all customers. 95% of customers stay with us. This and more is what we believe sets us apart. We offer products and service solutions that meet every need, with more than 300,000 products that support healthcare providers and end user. Medline today is #1 in market needed products such as exam gloves, durable medical equipment, surgical procedure tray kits, drapes, and gowns. Our medical products improve patient care and enhance the quality of people's lives. So to talk a little bit about our Mexico manufacturing sites, I'll start with the textile side. The Medline roots started in textiles back to 1910 when the Mills family founded a Chicago garment factory that made aprons for the stockyards. This business, as I said before, started long time in Mexico, 22 years ago. We developed great partnerships with contractors in the states of Mérida, Yucatán, and Coahuila, an operation today that employs more than 1,200 people. Mexico operation accounts for more than 50% of our apparel production and surgical products, professional protective care, and scrubs. Now to the kitting manufacturing, which is based in Nuevo Laredo and Mexicali. Our surgical kit manufacturing was established more than 30 years ago in Nuevo Laredo. We started with an operation of approximately 60 employees in a 15,000 square feet facility. Today, we have more than 4,000 employees in a facility with more than 1 million square feet. We have more than 60 production lines that produce more than 127 million kits per year. 2 years ago, as part of our expansion strategy, Medline expands its operation and starts manufacturing surgical kits in Mexicali. This operation was put in place to strengthen the region's supply chain of medical products. And today, Medline Mexicali has 2 manufacturing facilities with more than 3,000 employees. To highlight a couple of Nuevo Laredo and Mexicali manufacturing highlights, I want to start saying that all of these, as the other panelists have been saying, I think that the skilled employees are one of our strongest highlights. Kitting manufacturing in Nuevo Laredo and Mexicali is supported incredibly by an incredible workforce with more than 6,500 employees, in which Nuevo Laredo, we represent 11% of Nuevo Laredo workforce, Maquiladora workforce, which is huge for us. And throughout the years, Medline has been increasing its manufacturing distribution capacity. By doing so, we indirectly also support other industries such as construction, communication, transportation. Thanks to them, we have today 3 manufacturing sites, distribution centers that are about 1.6 million square feet. Also, we're super proud of last year, Nuevo Laredo was awarded with the Great Place to Work certification. With the support of our skilled workforce, we are able to ship 9.6 million kitting cases a year, manage a warehouse with more than 179,000 store locations with more than 35,000 components. And our employees are always motivated to go above and beyond the company goals. We are in awe of that. Going to the textiles of manufacturing to share a little bit of the highlights that we have. Textiles is also supported by an extraordinary skilled workforce. Their skill set on the Yucatan region dates back to hundreds of years ago with the traditional men's shirt guayabera, also known as the camisa Yucatan. They are very skilled sewers. They have been for centuries. So with their expertise, we are able to cut, sew, and ship product to the US in about 2 weeks, servicing our customers to a 98% service level with an outstanding quality level. Also, with the TMEC agreement, we're able to remain competitive, allowing us to ship product with imported materials as a preference duty level. With the lead time, the quality level of our skilled workforce, these and others are some of the reasons why Mexico is a great partner to us. And we are proud to be engaged also in social responsibility practice. We focus on providing a great product, but we also focus on social responsibility. Our efforts bring to life the company values that have driven action for generations, and they center around 3 pillars: community impact, global health, and sustainability. Through our community impact program, doing fundraisers, volunteering, and supporting local charities, we work to address so that everyone has the opportunity to reach their full health potential, regardless of their circumstance. Medline's Global Health Initiative unites nonprofit organizations, health systems, and Medline employees who serve as global health volunteers to develop projects focused on 3 key programming areas: supply chain optimization, efficiencies, and health education. Sustainability is a pressing healthcare issue requiring solutions that recognize the essential relationship between climate change and human health. We're dedicated to help healthcare run more sustainable. And to mention some of the activities that our Mexico facilities work on, we have donated to the Red Cross. Each employee sponsors kids to provide them with school supplies. We have donated to the Breast Cancer Association. And our employees are always looking to be volunteering and help their communities as well in many, many other activities. And I believe that's the last one for me.
Cynthia, thank you very much.
Thank you for the opportunity.
I'd like to thank you all for great presentations in telling the audience a little bit about who you are, and especially about your culture and what makes you tick. It's very important. I might ask a question and on how you can put on your economic development hat, but all of these companies have operations in Baja. And when you look at clusters and the size of clusters, even within Mexico in medical devices, you know, Baja shows us the greatest participation in terms of numbers of companies. And even when you look at other industries, I mean, we've looked at automotive and IT already. We're going to be looking at aerospace. Still, from what we can see, the Baja area is just enormous in terms of what it is providing. Why? Why is everybody in Baja?
That is a very, very good question. One of the key factors from Baja California is that we are, I will say, in a very, very well geographic location, because we have the access to the US as well. We can go through the Asia and Pacific area as well, and we have a lot of many sources to move product not only in the US but as well in Tijuana. We are developing and have the structure with our international airport, and we have Ensenada Ocean Port, that we can start moving product worldwide as well, using the structure of the US close to us, like Los Angeles, San Diego, and that area. As well, as you mentioned, why we have been successful is because we have been working very close with the universities to develop people. We have a lot of experience, as Miguel mentioned, we have more than 30 years of experience of medical devices, but not only in the medical industry, but as well on the electronic industry. We have a lot of experience as well. I can recall that not far away, Tijuana was called the TV capital of the world because we produce as many TVs exported to the world. So we have as well, we have our space industry. So the success has been that all industry, we have been working in a cluster model that help us to create that synergy that I mentioned to look for a common benefit for the industry.
Thank you. That's a great answer. You know, back in the early days, and my experience in the maquila industry goes back to around 1979. Companies going to Mexico talked about transferring products and product lines. And today it's more talking about transferring technology. But let me ask you, your products are all very sophisticated. In the years that you've been in Mexico, to what degree has technology been developed in Mexico rather than transferred to Mexico? I mean, any of you could answer this question if you want.
Sure. You know, in the case of Medtronic, Ralph, the R&D functions not necessarily resides on the sites, but mostly in corporate. So what we do is partner with R&D since the early stages of the product development in order to have the voice of operations reflected into the product in terms of manufacturing, because it's not the same. It's not the same to build a prototype at a lab scale versus putting into mass production. So,
Right.
So it's key that manufacturing participate in the process development in order to ensure that the product could be made at a commercial scale. So another thing that has been key for the success of Mexico operations is creativity is pretty well ingrained in the Mexico culture. You know, we Mexicans by nature, we are very creative. So it has fostered innovation at manufacturing to improve the process, to improve the product, be more efficient, and have a more reliable output for products. So I see that's what is going on, at least in Medtronic experience.
Javier and Cynthia, would you sort of agree with that as far as your companies are concerned?
Go ahead.
Totally. Yeah, totally. I think that it goes hand in hand. If our corporate and liaison with our manufacturers in Mexico, I think that I will agree with what Miguel said. We have to have a voice on the innovation that is happening, making sure that what we're going to be putting in place to manufacture, it's going to be cost efficient, is going to improve the conditions of what we're trying to achieve. And I believe also that the innovation can come the other way around. It can be from the manufacturer to the corporate facility, that we want to be able to innovate on X, Y, or Z, so we could provide a better product, a cost-efficient product. So I believe it goes both ways. I agree with Miguel.
Javier?
Something that I like to add, it is that to participate in the earliest stages of our product development. For example, this is, as I mentioned, Helios will be the second product that we participate in that development. The first one was the Pro Plus, and we finalized the commercial release last December. So, for example, right now in Helios, which is the new product that we'll introduce next year, we are in the engineering model stage. So what does that mean? That instead of doing in a lab, let's say in Batesville, and you're familiar with that site as well,
Yep.
Ralph,
Yep.
now we are participating in the early stages. After this engineering model will be the design manufacturing verification, and then the commercial release. So another good aspect for this product development, it is to start in earlier station, but definitely, as Miguel and Cynthia mentioned, it is to have that resource and that focus, and not only because of the capabilities of our people, but also the technology developed. As I mentioned again, it is radio frequency, welding, and all those key materials that we are facing right now. So that's another aspect that I like to add to this topic.
Thank you. Again, going back to my early stages in 1979, when you look at the total value of a product that was exported from Mexico, aside the labor, only 2% was contributed in materials. And most of that was on the administrative side, not on the manufacturing side. In your years in Mexico, I mean, Miguel, you said you go back to 1988. To what degree have you been able to develop or find local suppliers for components that you need?
Well, you know, it has been a long and winding road. You know, we have increased probably not at the speed that we need, and it's something that medical devices in Mexico as a group will need to leverage to further develop suppliers, because if I compare with automotive, in which the whole you know, supply chain it's close to manufacturing, we are not at the stage. I would say that at least here we will be around the 10%, 15% of local suppliers, but you know, there's a long way to go here to be where we need to be in terms of vertically integrating our suppliers into our operations.
But what you're also saying is there are a lot of opportunities for people who could be tier 1, 2, or 3 suppliers to you to actually start operations in Mexico to support you.
I think that's one item, because you know, a lot of the investors look for quick return of investment, and it's something that does not happen in medtech. You know, it takes a long time to qualify a component, to do all the testing, and then to get all the regulatory approvals. You can eat up a good year and a half, 2 years to get the actual component into commercial products. So there should be some ways to support those investors to you know, survive that period of time.
Cynthia, I know in textile products, I mean, you use a lot of fabric, yarn, thread, and so forth. Can some of that be obtained in Mexico, or does it have to come from other countries?
Right now, it's not coming from Mexico. Not everything, but we were just in a meeting yesterday with the Secretary of Economy, Tatiana Cloutier, and that was what Medline was asking her. One of the things that I think that will help us is to find those suppliers, be competitive, be able to find those suppliers not only on the molded plastics and fabrics and textiles, but I think that we definitely need help on that. Medline recently started a sourcing strategy. We found that with what happened with the pandemic, we needed to have sources here as well, and invest on those relationships to make sure that we are competitive on price as well. So we have our own strategy that recently started to make sure that we found and that we found those suppliers that we badly need from Mexico, so we can start buying more from Mexico, not from overseas. Buy those, invest on those partnerships so we can be competitive.
Javier, can any of your materials be obtained locally?
The answer is yes, Ralph. You also have the experience to know this site, the Monterrey site, in the early stages.
Right.
So right now, not only but frames, which are metal mechanics components here developed in Monterrey, also are for the surfaces area are the foam. So the foam that we are using in our surfaces or medical surfaces devices has been developed 2 years ago with a local supplier. Now it is opportunity for this local supplier to export to one of our Batesville site that you also are familiar with. So it is both ways, not only from bringing or develop a local suppliers moving components from the US here, but also once we develop the Mexican supplier or local supplier, we are providing all the infrastructure to help them to export to our sister sites in the US.
Okay. Question, obviously, how has COVID affected your operations in Mexico? And I'm talking not only about supply chain, but also your employees. I mean, have your operations been shut down? Have you found necessity to curtail production hours? How did the employees manage themselves through what we've seen so far? Miguel, you could chat about this, but also Angel, you might have some answers as far as the cluster is concerned.
Well, definitely, we had an impact on the industry as well of the rest of the, all the places due to restrictions and the CENEGI protocols that we implement. However, as the medical device industry was considered essential, we keep up and running our sites, producing product, because as I was mentioned to in other scenarios, we know that the COVID-19 right now is the rock star in the health industry, but the other illness continue, cancer continue, blood pressure continue, all the rest situation continues. So we continue working. I will say that the old medical device industry, one main focus was to preserve the health of our employees and be sure that all of them were safe, and not only the employees, but as well their family, because we know that this pandemic was a very contagious situation, and we need to be sure that we keep safe the workplace and our employees as well. I will let the rest of the panelists to continue with this and explain their experience that they had.
Anyone? Don't be shy.
So,
Go ahead.
so for us, as Angel was explaining, that we were considered essential. So our manufacturing sites continue to be open. Of course, a lot of training, a lot of resources have to be put in place to keep doing so. So it was unbelievable, the support that we got from all of our employees to keep our facilities running. I think that, and I've heard from the panelists too, it is our mission. We know that people rely on us, the lives of people relies on the products that we make. And it was outstanding, the support that we got. So I will say that we remain open every day. I remember waking up and not knowing, is this going to be closed today? Is this going to be open today? The textiles was a little bit more affected, I would say, than the kitting manufacturing on when you are in a small town, everybody fears, and the news about the bad things go really quick. So it was a lot of training, a lot of talking, but I will say a lot of support from our Mexican employees. They were outstanding. They believed on what we were doing. They knew that everybody needed us. We make sure that we donated as well part of our product to overcome the crisis that Mexico was facing, not only the US, or globally, and they were really appreciative of that. So I would say yes, a lot of struggles, hand sanitizer, mask, and this, and without having the supply, it was tough. But yeah, we managed, and we're thankful for the support that we got definitely from Mexico.
Thank you, Cynthia. Javier, you have any comments on this?
Yeah, something that I'd like to add, it is, as Cynthia mentioned, it is a lot of training, but more important, awareness and information. Sometimes we react or overreact with that limited information, or with rumors or any non-confirmed information. So we are every day receiving from the health department here in Nuevo León where we are and what is the trend on positive cases. Just for your information, here in Nuevo León, at the beginning of July, we were 200 positive cases, and we end the month of July with 1,300. So now it is more awareness, and we are providing or continue to provide the protocols, and definitely more important, with this third wave that we are seeing all over the world, we are reactivating all the protocols. We used to have acrylic masks back in June, for example, and June, July, we removed it. Now we are going back to use I have it here, the acrylic face shields also as an additional for the face mask as well. So it is continuing following all the protocols, temperature verification at the entrance of the sites, temperature verifications on the exit of the sites, 1.5 meters distance or social distance. So all those trainings and by the or through the EHS department, we are practicing dry runs or practicing audits or practicing every day that we have to follow those rules. But more important, every day we receive, and I receive a calls early in the morning, that any symptoms that they perceive is either cold, headache, I ask them to stay at home. So our number one priority, it is to our people, but more important, it is to keep them safe and healthy.
Okay. Cynthia, since you're in apparel a lot, have you been engaged in producing, let's say, personal protective equipment more than you normally would in a normal year?
Oh, yes, yes. We had to, our doors were definitely called, because everybody that was doing apparel not related to any surgical definitely wanted to stay operating and help and support everybody that was in need. But yes, no, it was constant. It was definitely more than what we had experienced before. And the support, as I said before, was incredible. So yes, our numbers were unbelievable. Our requests, like our phones will never stop. So it's definitely, we were under pressure trying to provide everybody with the protective apparel that they needed. And fortunately, we had a little bit to do with it and support the healthcare system.
Thank you. Two questions from the audience. First, I guess for you, Miguel, do you produce liver function tests, or what are called LFTs?
No, we don't produce those. Mostly it's cardiac devices, cardiology.
Okay, thank you. And the other one, I guess, could be a question as to the potential suppliers in Mexico that could support you. Would you characterize them as wholly Mexican-owned, or might they be foreign suppliers? Because I think we see now, with the levels of tariffs on goods from China, and also with the USMCA, there might be more and more Chinese companies that might be going to Mexico to support customers.
Well, yeah. What I've seen so far here, Ralph, is it's a mix between purely local supplier, Mexican suppliers, and from foreigners, is mostly from United States companies that are putting facilities to supply componentry.
Okay, good. Well, we're getting to our witching hour, and again, I'd like to thank all of you, and I'd like to ask the ambassador and the consul if they have any final comments for us.
Thank you so much, Ralph, and thank you to everybody that connected today with us. I see good friends from the Chamber of Commerce in Naperville and other local stakeholders interested in this issue. I think it was fascinating for me to learn all the details. I'm pretty sure that it's much more complex than what you had the opportunity, the time you had to explain to us, of course. But I'm looking forward to visit some of your plants, not only here, but also in Mexico. It's really fascinating, and it's really interesting to see how this connection between Mexico and the United States deepens because of the work that you are doing. And that's something that is not only benefiting the economies of the countries, but also the local economies and the local pockets of the communities where these industries are settled. So I really appreciate that. I really appreciate all that you explained to us about that human aspect of the work that you are doing. So thank you. And this is not it. I think we should continue the conversation because there is a lot of potential here. So thank you to all of you.
Thank you, Ambassador. Consul, you have any comments? Final words?
Thank you very much, Ralph. Well, first of all, I want to thank everyone because as Ambassador Torres just said, it was very interesting to learn what you do in our country and what you do for this very important industry. And after this year of the pandemic, it's obvious that the world has changed enormously. So we have huge challenges ahead, but we also have big opportunities. So I think that we need to take advantage of all the tools that we have in our hands, like the USMCA and all the infrastructure that we have built during these last 25 years. So, well, this is a confirmation that Mexico, Canada, and US are not just friends, but are important allies. So thank you very much for this very interesting webinar. And thank you for the invitation to the Chamber and to Ambassador Torres.
Yes, thank you. First, the PowerPoints will be available on our website tomorrow under resources. We're going to have to do some editing of the video, but that'll also be posted hopefully within the next day. As the ambassador had mentioned, our next one on our schedule will be aerospace, and that will probably be in the beginning of October. And then we're going to do one on appliances. We're going to do one on supply chain and also one on clusters. We've already had great participation. Thank you very much, Angel. Also from the automotive industry and also from IT. So we're going to do one session just on clusters. But in the meantime, be well and stay safe. See you soon.
Thank you.
Bye-bye.
Bye.
Thank you.
Bye-bye.
Bye.
Thank you. Bye.